Hello, I'm Dr. Maylee Devlin, and I am the Naturopathic Doctor of the Ontario Health Connection Group. And my focus and practice is really helping patients improve their overall health so they can improve their health span and not just their lifespan. And so mental health is a really big part of improving your overall health. As a naturopathic doctor, my approach involves a physical as well as mental assessment when I work with patients. So we go through the physical pieces of something like anxiety or depression or low mood and figure out what could be happening from a physiological level. Some things that can make an impact here are vitamin deficiencies like vitamin D, vitamin B12, as well as iron. And then we also look at nutrition. Nutrition plays a massive role in mental health. And so we want to look at what foods are you eating? How has your appetite changed? Are you ensuring that you're eating enough and enough of the foods that really help your brain make the appropriate neurotransmitters that it needs to make sure that you have a healthy mental state? Now, we also focus on that person's environment. And so we look at the role that stress plays in their life. We look at the impact of the anxiety or low mood on things like their sleep or their eating habits. And so we can see how the environmental piece as well as the physical piece are very closely related. And so when we look at different therapies for mental health, we have to first look at what's going on. So that's part of the assessment piece and part of the intake. And then when we talk about therapies, we have to find things that the patient really feels like they're doable. So for example, if we start with nutrition, we like to start really slow, and I like to start by adding things in. So there are specific foods that really have a good basis and evidence for improving mood. So things like getting enough fruits and vegetables in your diet, enough protein to make sure you're covering your bases. The next piece I like to add in is exercise. And so Dr. Monica talked all about this. There's tons of research looking at the improvement of mood with adding in exercise. And again, we always have to start where the patient feels comfortable. So maybe that means adding in a 10-minute walk to start, right? Maybe it means improving the environment in which that person wants to exercise. Maybe they don't want to work out in a gym. Maybe they need to, go work with someone like Monica to teach them the pieces of exercise before maybe they're feeling a little bit lost. So we've got nutrition, we've got exercise. There's lots of supplements that I use to add in. For example, L-theanine or GABA are really helpful for anxiety, or we have saffron for low mood, or lavender if your anxiety is impacting something like your sleep. But we really don't like to start with the supplement piece right away because we really want to get those bases in first. So the nutrition, things like water, sleep, exercise, and sometimes we use supplements as a tool to help you get there. So maybe, for example, if you don't have enough energy to exercise because you're not sleeping, we might help with sleep in the form of supplements. I also, in person in clinic in Toronto, I also use acupuncture as part of my therapies, and I find this really helpful for more of an anxiety picture of mental health. And as Dion mentioned, mental health support is not just correcting something where someone feels unwell, it's also making sure you feel supported throughout life and not just getting by, but also thriving. And that always comes back to when we talk about rather than just longevity and improving your lifespan, we always want to make sure we're improving your health span. And so how healthy you are while you're living. And part of that is making sure that you have optimal mental health. So I hope that's helpful and gives you some insight on how a naturopathic doctor would work with mental health patients.